I would like to thank Dr. Aditya for giving me this opportunity and including me in this instruction course. I will be discussing about OCT biomarkers in diabetic macular edema. I will be discussing under two sections, the biomarkers which predict the functional outcome and the biomarkers that predict the anatomical outcome. Coming to the biomarkers that predict the functional outcome related to the inner retina, disorganization of retinal inner layers, abbreviated as DRIL. It is defined as the inability to identify boundaries between the ganglion cell layer, inner plexiform layer, and the inner nuclear layer and outer plexiform layer. Here we can see that the boundary between the outer plexiform layer and the inner nuclear layer is intact. But if we see on this side, we see that the individual layers cannot be made out distinctly. This indicates DRIL. It is usually associated with severe macular ischemia, as we can see that the corresponding OCTA of the patient shows significant fluvoid areas. Coming to an example, here we can see that this patient of DME has a DRIL on one half of the fovea, as we can see over here. Post-treatment, though there is complete resolution of intraretinal cystoid spaces, the visual acuity gain is limited. This is partly due to the presence of DRIL. So DRIL is a very well-studied biomarker which indicates a poor functional outcome in diabetic macular edema. Coming to the intraretinal cystoid spaces, it has been described that presence of more number of intraretinal cystoid spaces and the increase in the ratio of these spaces to the area of retina, which is defined as the area ratio, is associated with a poor long-term visual acuity. We know that the intraretinal cystoid spaces are usually located in the inner retina, but they are known to result in a photoreceptor disruption over long term. It has been hypothesized to be due to the detrimental effect of these spaces on the Muller cells, which are essential for the survival of the neurons, and it is also due to the disruption of the outer plexiform layer, where the photoreceptor cells synapse with the secondary neurons. So, even though the spaces are present within the inner retina, over a long time, it is known to be associated with disruption of photoreceptors. So it's a poor prognostic indicator. The next biomarker, the pearl necklace sign, it is defined as the presence of hyperreflective dots in a contagious ring around the inner wall of cystoid space, as we can see over here. It is usually a precursor of hard exudate clump. So when the macular edema resolves, here the hard exudate would precipitate. So if it's located at the fovea, it is an indicator of poor visual outcome, as the hard exudates which precipitates at the fovea results in outer retinal disruption. Bridging retinal processes. Here we can see that within this cyst there is a bridging process. This process usually is indicative of a better visual function, as they would be suggestive of a neural elements bridging the inner and outer retina. So we can see that in this patient, the visual acuity was fairly good at presentation, but due to persistent edema, the bridging retinal process are lost, and we can see that the visual acuity has reduced. When this patient was treated with the laser photocoagulation, we can see that the macular edema has resolved completely, but the visual acuity did not improve much. So the bridging retinal processes would be an indicator of good visual outcome in diabetic macular edema. Coming to the predictors of functional outcome related to outer retina, the integrity of ellipsoid zone and the interdigitation zone. Here we can see that the ellipsoid zone is intact even at the area where there is a macular neurosensory detachment, and post-treatment we can see that there is complete resolution of macular edema and there is an intact ellipsoid zone and an interdigitation zone. So the patient gained a very good visual acuity. Whereas in this case, we can see that there is loss of ellipsoid zone at the area of neurosensory detachment and even in other areas, but the external limiting membrane is preserved. Post-treatment, there is a resolution of macular edema, and we can see that the external limiting membrane is preserved, but the ellipsoid zone is disrupted and interdigitation zone is disrupted. So in this case, the visual acuity improvement was minimal. Whereas in this case, we can see that both the external limiting membrane and ellipsoid zone is disrupted. Though there is complete resolution of macular edema, we can see that there is no improvement in visual acuity. So in patients, if we see that there is an intact external limiting membrane and ellipsoid zone, the visual acuity is usually better and the functional outcome is good compared to those cases in which there is an ellipsoid zone disruption with an intact external limiting membrane. But if both external limiting membrane and ellipsoid zone are disrupted, the visual acuity tend to be quite poor. Coming to the next biomarker, the subretinal fluid. The presence of pre-treatment subretinal fluid at baseline was noted to be associated with better visual outcome compared to the cases without any subretinal fluid at baseline in post hoc study of Reed and Rice, whereas a similar observation was not seen in the post hoc analysis of VISTA and VIVID, which evaluated aflibercept in DME. The subretinal fluid has been shown to be a better biomarker of functional outcome in patients treated with dexamethasone implant also. The mechanism is not very well understood. Coming to the predictors of anatomical outcome, the predictors of anatomical outcome usually also influences the functional outcome, as if there is anatomical improvement, then only we can expect a functional improvement. Coming to the vitro-retinal interface, vitreomacular adhesion. It is defined as perifoveal separation of posterior cortical vitreous from the surface of retina with attachment within the central 1500 microns of fovea. If the attachment is less than 1500 micron, it's called focal vitreomacular adhesion. If it's broader than 1500 micron, it's called broad vitreomacular adhesion. With intravitreal injections, posterior vitreous detachment occurs. It is more often seen with focal vitreomacular adhesion than broad vitreomacular adhesion. The development of PVD is usually associated with a better resolution of macular edema. Though there is no traction in these cases, the development of PVD is supposed to be helpful in resolution of macular edema by a few hypotheses. As we can see that there is increase in oxygenation of the inner retina and there is a removal of the reservoir of factors in the premacular space, which would be contributing to the development of macular edema. There is only one study which has evaluated its role as a biomarker, so it needs further studies to confirm. Epiretinal membrane. Epiretinal membrane usually indicates presence of a tractional component, a tangential traction on the surface of the retina. Here we can see that in this case, though there is complete resolution of submacular fluid post-treatment, the retinal thickness is almost same. This is mainly due to the traction exerted by the epiretinal membrane on inner retina. It would need a surgery to remove the epiretinal membrane. Coming to the predictors of anatomical outcome in inner and outer retina, the hyperreflectivity.
Doctor, may I please request you to sum up within a minute?
Sure, thank you. Hyperreflectivity of cyst wall. Here we can see that in this cyst, the wall is hyperreflective and it usually indicates a more severe photoreceptor disruption, as we can see over here, which is evidenced by the loss of ellipsoid zone and external limiting membrane. It is associated with poor visual acuity. It is usually suggestive of a persistent cyst and the chances of remission is lesser. As an example, here we can see that the same case post intravitreal anti-VEGF, the cyst has only partially decreased in size. Hyperreflective foci, it has been described well. It's a small discrete lesion less than 30 micron in size. They are dot shaped. They have equal or greater reflectivity than RPE band. It is described that it is an indicator of poor response to anti-VEGF, as we can see over here. But it is also described that they may respond better to steroid. To the choroid, the subfoveal choroidal thickness, if it is
Doctor, with all due respect, I wish that you could just come to the concluding slide.
Yeah, thank you. It is a better anatomical and functional outcome. Thank you.